Today's video, I will be talking about my pregnancy updates. I am now week 36, so I will be sharing about what has been happening, how I've been feeling, and yeah. So, first of all, I've been feeling good. I don't feel like crazy tired. When I wake up, I feel energized and very fit. Also, I've been now noticing I'm getting more cramps on my leg, and sometimes I forget like to stretch it, to move it around so the pain goes away. And then I've been having already a couple times leg cramps, then nose bleeding I had, but nothing just recently. Headache I had for the heat, you know. And what else? Abdominal cramps, then lower back cramps, contractions on the back, and then on the abdominal area. What else? Hungry. I don't feel too hungry. I mean, I eat because I'm pregnant, but I don't feel that much hungry really. Even in the beginning during the pregnancy, yeah, I felt a little bit more hungry than normal, but I don't get crazy hungry, like I'm craving food constantly, like I need to eat all the time. So also, what else? That's now what I how I've been feeling. I've been feeling good. I had a few times anxiety attacks because that normally happens when she's too active, because she moves now a lot more, which is surprising because there's not much space. And Adam, when he screams like that, she moves more. So she's acknowledging, oh yeah, I have a brother coming. Like I have a brother here. Once I'm coming to this world, I can play with him and cause trouble, you know. And yeah, so I will start with talking about what the OB is saying, how things are. So I check my blood pressure regularly. Today it was 112. Top number and bottom number was 66, so that's perfect. In this pregnancy, my blood pressure is stable. When I was pregnant with Adam, it was too high, which I was surprised that in this pregnancy it's not that high, which is most likely because of the baby aspirin, and probably because now my body is more relaxed. Probably for that reason, because the medication I took before was a little bit different than I'm taking now. Because once Adam was born, some of the medication I stopped taking too, and could be for the diet too. So it could be many reasons. I'm not sure, but this is what I'm saying, what I'm assuming. So when I talked to the OB, she says, "Oh, baby looks good." So her butt was sticking to my belly more, because she says I can see her butt is facing more to where my belly button is. So she's right there, and the head is still up here, her head. So she hasn't changed position with her head being down and her legs up. So she's still in the same position. I asked, when does she change? The doctor said, why would it matter? You're having a C-section. So my weight is good too. I I lost a bit of weight. So last time I weighed myself, it was 108. Then it was first 109, then 108, now 107.5. So I lost a bit of weight, which she says is normal because it's my second pregnancy. So I'm not gonna gain much weight, which surprised me because I thought all pregnancies would be the same, whether it's your first child, your second child, your third, and so on. I didn't know that when you're pregnant with your second child, you're not going to gain much weight. Probably if you're pregnant with twins, you will, but this is one child. So, so yeah, and then I asked about the time when the baby will be born. She says, I don't know. They most likely will call you for this week or Next week, close to the dates, the baby will be born. So baby will be born September 10. So they might call me on the 8th or the 9th. So today, when we were at the grocery store to buy groceries, I received a phone call from the Abbotsford Hospital, and they did an assessment to check on how am I doing, blood pressure, how much I weigh, my height. So I told them I am 5'9", I weigh 107.5. My blood pressure is perfect, so they're happy with it. And then they said that if I have any questions, I am free to ask, or once the phone call is done, I can call and ask if I forget something. So what the woman told me on the phone was, she asked if I've had any allergies, and I said for the previous transplant medication I took, I was allergic to it. Then she wanted to know what are the side effects. I said rashes, and my hair used to be down to my belly button, so half of my hair broke off, so it just snapped, and I had a lot of that hair in the shower. So that was one side effect I had, and then the rash. So so yeah, I was saying that, and then she told me that the C-section September 10, which I know, and I asked what time will they call me, and she says they probably will call you September 8th or September 9th, the latest. So she says if you're not getting any call within lunchtime, you call. And I'm like, well, that's just great. Just call and let me know. I don't need to call. I'm not the one responsible for the surgery. I'm the one who's receiving it. So she told me when I go, the day before September 8th, I should wash my whole body, wash my hair, because within 24 hours I'm not going to be able to shower. She says just wash myself very good. Don't use any perfumes, any lotions. Don't put any hair products in your hair. So that probably too. Maybe it does something with the C-section, I don't know. But they said just shower and that's it. And then she told me to buy these surgical sponges that you use to clean your area where you get the surgery done. So on my belly. And after taking a shower on the 8th, September 8th, then to take a shower again in the evening to keep myself clean, and then in the early morning at 9. So after 24 hours, I can wash my hair again as I do. So they said you need to be extra clean because you're going through surgery. Remove all your jewelry, your necklaces, your bracelet, your rings. Well, with this earring, it's gonna be hard to remove it because I even tried to unscrew it and that lock is, I guess, stuck, so I wouldn't be able to unlock it. So, I mean, I don't think the earrings, because I'm not wearing earrings, I only have one here. Because I had an ear infection, so it got infected here. That's why I stopped wearing earrings so they can heal. So yeah, they said just to remove all jewelry and then to shower more and to use that. Then she told me they will call me before 12. Like I said, if not, I need to call. I asked about my son, if he can come inside. They said no. They said once the surgery is done, after lunchtime, he can stay with me. He can stay the night there. So we will look for somebody to take care of him. Um, then they said I need to do fasting, so I will not eat for 8 hours, and then to drink water I will, and then they don't want me to drink for 3 hours, which is okay. I mean, the day before I can just eat well, drink enough water, rest. So with this procedure, I will take anesthesia, so I will be asleep. So once the baby comes out, it's out of my body, they snip off the umbilical cord and then they clip it, they wash her and everything. By that time, I'm already conscious. So once I am at the anesthesia and then I come out of the anesthesia, I'm gonna be all loopy. So I surgery will film me when I come out of anesthesia. So then you guys have something to laugh at. But yeah, so they told me I can be in the hospital for 2 days or a whole week. So it depends how well I'm healing. If there's any complications, I'm gonna stay longer. Then I will need to do blood work for them to make sure if it's urgent for me to get blood transfusion in case something happens. Because I asked before if before I would have gotten the kidney, if I could get a blood transfusion, because they wanted to give me a blood transfusion when I wasn't producing enough blood cells. And when they told me that, they said if we do that, you're not gonna be able to get a kidney. So instead of that, they gave me injections. So if I would have gotten blood donated before the transplant, I wouldn't be able to get a kidney. But now that I have a kidney, I can receive blood transfusion. So I asked, I don't know my donor's blood type, so would that impact too with the blood work? And they said your blood work will show your blood type that you'll be negative, right? So it might show if your body ever fought off any other blood cells, or in a way if the donor matched your blood type or if the donor was O negative. That's what they said. They cannot really tell, but somewhat in the blood work it will say something is different. She says she doesn't know how to explain because that's not her category. Because she's in the maternity, she just registered people and she's a nurse, so she wouldn't be familiar with blood work like that. So this is a whole different story. And then she told me if my water breaks before, just to come in and get it checked. I don't need to feel shy or hesitate to come. I said no, I don't feel shy. If something happens, I will come, or if I have questions. So yeah, so yeah, I'm pretty excited. So most likely the next video that I will be doing will be when we're already in the hospital. I will be filming the baby and updates too, how things are. So she was telling me most likely I'm not gonna stay in the hospital for that long because I don't have anything serious. Oh, there's another thing with the neurologist, yeah, the brain doctor, because I had a history of seizures when I was almost 1 year old for the TCS, the tuberous sclerosis complex, which is you can have tumors in your brain, your heart, your lungs, your liver, in your organs, but these tumors are non-cancerous. So I take medication to prevent it. So last time when I got my MRI done, they told me there's no bruising, there's no swelling, which I had that since I was 10. So that's good. I am happy about that. But they said to me that I will need to talk to them. So they said they will call the doctor and the doctor will talk to me, or she will call them, or the doctor will call. So they're figuring things out so they can get the information. And she told me they need to actually increase your medication. And I said, the reason why I believe my medication is so low is because of because my thyroid is now starting to balance my hormones. Like you see, it's still there. It's a bit puffy. So once she's born, probably within December, I feel like, or maybe early March, I'm sure within next year this is gone, because your body needs to adjust with the hormones. It doesn't happen overnight. Normally, I'm thinking 3 to 6 months it takes to regulate the hormones. But yes, you can see it's still a bit here, but it looks good. So my face doesn't look so so poofy, so swollen. Looks more thinner. And yeah, my skin looks better too, also with the hormonal changes. But yeah, nevertheless, that's I was explaining to her it could be very likely because of that reason that my lamotrigine is low, because of my hormones starting to balance. And also I was reading that when you have a strong metabolism, some of your medication level will be lower, and then it goes higher too. So it depends. Probably at the moment my body is not used to it. that um, that I'm taking the lamotrigine at that level at 100 milligrams. And because the previous pregnancy I had with Adam, they said they increased it because they could see it was low. But I told them, of course it's low because I was told by the doctor not to take it. And even I told her, the hormonal specialist said you shouldn't be taking it because that's what's messing up your hormones. Because I asked if it's related with the kidneys, and he says, no, it has nothing to do with the kidneys. It's because of your medication. It's a side effect. And then I said, so you think I should not take that medication? He says, yeah, you shouldn't be taking it. So I wasn't taking it. And then I noticed I started to lose excessive body hair. And then I took it and then it came back. So that's just great. Because that whole hormonal issue started when I was 14. So that the fact that my hormones are balancing is probably unfamiliar for my body with the medication. That probably the medication is is being confused because it's inside my system. And yeah, the hormones were not balanced before. Now they're starting to regulate because it started before puberty, my excessive body hair. So yeah, what I was sharing, that's about it. So I will also have an appointment with the social worker September 25th. Then I will have another checkup with the OB. She says she thinks it's good to check, and I thought it's good. I agree that it's good. I just think it's weird because most of the time the OB, like the previous one I had, she wouldn't say, oh hey, you should come to the OB clinic and let's do an assessment to check how you're doing. This pregnancy is way different compared to the one with Adam, because with Adam I had the epidural. With this one I'm gonna have the anesthesia, and then I'm gonna have another assessment with the OB. And the visits with the OBs, they're normally 20, 20 to 40 minutes long, and then previous OB it was like 40 minutes to close to hour. So there's a lot of differences. But yeah, that's it with all the updates. Any new updates, I can make another video about that. But in anyways, the next video will be in the hospital, or maybe in between something else I can film. But yeah, mainly I'm gonna film a lot in the hospital to film the baby and to share my experience and how I feel, and then other stuff too. So we'll see. So I hope you like this video. Thank you for watching. Bye.